Hello, everyone. Welcome to another episode of You the Mom. I'm Janice, the founder of Mommy Mundo. Today's topic is all about your child's teeth, your child's pearly whites. How do you keep them healthy? What are the habits to build while they're young? We have a special guest today. She's a old friend of mine. We've known each other since we were maybe 6 years old, I think. Um, so I will first introduce her to you. Her name is Dr. Georgina Roa Remulla. She has earned 2 undergraduate degrees from BS Biology from UST, syempre pati academic, di ba? And Doctor of Dental Medicine at the UP Manila. She placed 7th in the dental licensing exam in 1996 and later on pursued a certificate in pediatric dentistry at the Columbia University School of Dental and Oral Surgery in New York. In 2000, she focused her practice to the treatment of infants, children, adolescents, and children with special needs. Dr. Georgia served as the president of the Philippine Pediatric Dental Society from 2004 to 2008 and currently program director of the Advanced Education in Pediatric Dentistry at the Pediatric Dentistry Center Philippines. She is a diplomate at the Philippine Board of Pediatric Dentistry, a fellow of the International College of Dentists, and a member of the Philippine Pediatric Dental Society, American Association of Asia, American Academy of Pediatric Dentistry, Pediatric Dentistry Association of Asia, International Association of Pediatric Dentistry, and the Philippine Dental Association. Woo! So needless to say,
time's up.
Dr. Georgia is very active in her field. She's not only a very well-loved doctor the past, 20 years? More?
Yes, 20,
20 years.
21.
You've always advocated building good habits. You've been active in Mommy Mundo as well, doing this as well. And, you're also really active in the medical community to just keep helping as well your fellow professionals and also just keeping up with the times, right? So I'm so happy you said yes to me again, Dr. Georgia. Hello, how are you doing?
Good. Hi, Janice. Good to see you. We're in different time zones, but you look nice and fresh, even if it's like almost midnight.
Yeah, I know, right? This is my usual time, but thank you. You look nice and fresh as well. I miss the weather there, so it's good to see the sun behind you. But again, thank you for saying yes. You've always been so generous with your time. I know it's because you want to impart so many things to moms, like especially in helping them give their children the best start in keeping their kids' teeth healthy even before it sprouts out, right? I know there's like early ways that you can keep your child's mouth. Well, you can tell us more about that. I want to start with that actually. How early should parents start in the practice of keeping their kids' teeth or dental area healthy?
Okay, well, first visit usually to the dentist is we recommend as early as when the first tooth comes out or by 1 year old or earlier. Usually baby teeth come in six months. So by then, even if it's one tooth, pair of teeth, then they should already bring the child to the dentist to at least start already the habits, because it's more than just teeth to really start the habits. Before teeth come in, of course, wiping the gums are good, just with a soft cloth, damp soft cloth, wiping the gums, wiping the tongue, to just make the child used to getting their oral cavity really nice and clean. So
So how early should they start with the gum care? Like
as when they're
breastfeeding.
While they're breastfeeding, because you have the gums, you have the tongue that can have all the milk sitting in there. So you want it always nice and clean.
Yeah. So it's the cloth. Wrap it around your finger. Shucks, this is like 25 years ago. No, I'm just kidding.
Yes,
15 years ago naman.
That's the simplest. cloth or little towelette or little bib. We don't really, need for gauze because you have to buy pa. Not
Yeah.
cotton because cotton frays and,
Yeah.
you might leave some there. So just your towel or a bib. It would be good to
Or
start off the
around the gum
baby.
and then the tongue.
Yeah, around the gums and then the tongue
Yeah,
also.
because the tongue, di ba, some babies it becomes white because of the residue from the milk.
Yes,
So that's why
yes,
because you need to clean it
yes.
regularly.
Yes, and
Okay.
I think the best for cleaning the tongue is instead of like going towards the back of the throat, you kind of put the finger already a little bit on the side behind and move your finger outwards to so you don't tickle
Mm.
the throat. So it's a good
Yeah.
cleaning position
Okay.
instead of parang cleaning from the front to the back. It's from the back to the front.
Yeah, outwards.
So, yeah,
So,
outward.
and then when they have their first checkup with you, so you mentioned that it's really to start the habit of, um, like making it familiar for the kids,
Yeah.
the baby to be or the toddler to be with your in your clinic and having their mouths checked. Is that really it? And also you check on the whatever teeth's coming out.
Yeah, so actually it's a combination.
Yeah,
One is so they're more familiar. They do get familiar with the dentist because be a pediatric dentist, I
yeah,
see children all the way till they're 19, 20, sometimes 20 years old.
yeah,
So they're familiar with the place. One is there's no pain yet. So when there's no pain, then it's easier
yeah,
for them to, be more accepting of the habit of having dental care. One is we teach already parents good diet habits,
mm,
um, and then good teething habits, so how to clean the teeth, what's next, what teeth will be next, what are you
yeah,
expecting in this at this age, in a few months after this, what's going to come out.
yeah,
And then really, so at least the parent and the dentist have already this open communication, and
yeah,
anytime they're needing an opinion, or if they're wanting to ask something,
yeah.
then they're already familiar with the dentist, and the dentist is familiar
Yes,
with the child, and so they can really text and call and viber whatever their concerns
that's
are as the
true.
child is growing up.
Yeah,
So,
yeah.
and yeah, so we really call that kind of what we want is called a dental home. So,
Okay.
yeah, so it's the term for that. So it's a dental home. So basically, it's just that the parent and the dentist and the child have this kind of like communication, the bond. So at
Yeah.
least as
Starting off
they
your
grow,
relationship.
yeah, as they grow, then you can guide them into really good oral health.
Okay, that's nice. In dental home. That's a new term, and I love the concept
Mhm.
of it's really like starting a relationship with your
Yeah.
child's teacher and everything. So you mentioned that yeah, so the child becomes more relaxed with you. So it's like a well baby checkup, right? So you don't bring them there when they're
Yes,
sick
yes, that,
like that. And then
yes.
how do you have instances where the child is anxious? I know that I've been to your clinic once. I think I remember when my son was really, really young. We had the privilege of going to your clinic, and but you have many ways to keep them distracted, I guess, or engaged
Yes,
in your
yes, yes.
clinic. Can you tell us more about your setup? Like how do you create that atmosphere of making it, well, as you said, it's like a home as well, making it comfortable.
Yeah. Well, with my clinic before the
Yeah.
pandemic had really a whole lot of toys, a whole lot of little things, books to keep them entertained while they're waiting for their turn, or when they enter, it's like a toy store.
Yeah.
But now I have to like really trim it down, but I still
Yeah.
have big toys that can be not, it's more of like things that they can sit on, but I can wipe anything that I can wipe
Yeah,
down,
yeah.
so no more little things, but it's
Right.
still a very friendly, comfortable place.
And then your
So when they
screens,
come
of
to
course,
me,
your big screens.
yeah, and then I have, of course,
Yeah.
television, but the whole environment is just, something like, oh, something fun, something
Yeah.
relaxing, and they can easily, just kind of like get into the, not, this is not a scary place.
Yeah, that's true. Especially
So
that there's like a mindset na, oh, dentist is gonna be painful, right? Because
yes,
you go
yes,
there with a cavity already and
yes,
so that is a great way to start it off.
yes.
And then when the child already has like teeth, na really like at what age is that?
Well, 6 months,
Mm.
but
6 months.
at 1 year old, we really want them to
Yeah.
come in.
When do you expect them to actually hold the brush and start learning to brush on their own?
Okay, well, we always want supervised brushing
Yeah.
until 7, 8 years old. So
Yeah.
parents or caregivers, whoever is in charge of the child, will really need to brush the child's teeth all the way till at least probably 5, and then
Yeah.
kids can come in and or they can, when they're older, when they can hold the brush, when they can lift their hands, their arms properly, then
Yeah.
they can practice brushing, but still someone has to see and check if
Yeah.
they're brushing
If
properly.
it's thorough.
uh,
Yeah.
yeah, definitely a child 1, 3 years old, 4 years old, someone will still need to brush, and that's what we
Yeah.
also teach them, how to brush their child's teeth properly, because
Mhm.
there's cavities. There's still about 600 million children in the world with cavities.
Yeah.
And one thing I really want to emphasize is cavities are preventable. It's
Yeah.
very easy to prevent if parents really know and are aware of it. And yet, so many children still suffer from cavities and dental caries.
Yeah.
So that's why we really want them to know that, they have to come in early, and
Yeah.
we have ways to, and there are reasons why we want them to come in early, because a lot of parents would say, oh, there's no teeth
Yeah.
yet, or he'll
Right.
cry, or so we do work around those, and we do more than just brush the teeth
Yeah.
when it's
Right.
early visit.
Okay,
So
so
there.
Dr. Georgia, what are the basic habits that you would want to impart to moms? Like for example, there, as you mentioned, like what's the proper way to brush teeth? What toothpaste do they use? How often do they brush their teeth? Um, this is your opportunity to
Okay.
to educate us all.
Okay, so like I said,
Yeah.
preventives is really number one.
Yeah.
Cavities is a preventable disease,
Yeah.
and a lot are not familiar, but cavities or dental caries or tooth
Yeah.
decay has common factors, such as the cause of it is similar to non-communicable diseases that are like diabetes, cardiovascular
Yeah.
disease. So the enemy is sugar. Sugar is really the
Yeah.
enemy. So one, cavities is preventable. Two, do not introduce your child to any form of sugar, white sugar, brown sugar, honey, syrup, until at least two. I mean, they can really hold out until 2 years old. Why? Because we don't want the child to develop that sweet palate or just
Okay.
wanting to have sugars. And there's no nutritional value in sugar,
Yeah,
right? And
that's
it is
true.
what the natural bacteria in the mouth uses to cause cavities. Yeah,
Ah,
and
interesting.
then of course we advocate toothpaste with fluoride,
Yeah.
and it has to be a certain amount of fluoride. So 1,000 ppm fluoride, and to 1,400 ppm fluoride. So younger ones,
Mhm.
1,000 ppm. And a lot of parents will say, but my child, 1 year old, doesn't know how to spit.
Yeah.
That is why when we give, or when we say give toothpaste, it's also the amount of toothpaste that you have to
Yeah.
regulate. Diba?
Yes.
But they can't swallow toothpaste. Well, if they really can't swallow toothpaste, then it won't be so easily and readily accessible. They can't swallow a
Yeah.
lot of toothpaste, right?
Yeah.
You, the toothpaste has to really go on the teeth. So for a child, like 1 to 3 years old, it's really a smear, just a little smear, a little wipe
Okay.
of
Yeah, on the
toothpaste,
brush.
and that should be able to cover all the teeth. When they're older, you go half a pea size, and then
So it's
older,
not like
you're
the commercial. It's like like the
yeah,
full
not
brush.
even for adults. For
Yeah,
adults, it's still too much. You waste so much toothpaste. So
that's
I
right.
tell parents, you buy the smallest tube so you can really regulate
Yeah.
the amount. And then they're like, but they don't know how to spit. But we advocate really not rinsing out all the toothpaste. So
Oh,
with
really?
kids, yeah, because you lose the fluoride. So you're there
Okay.
brushing because you want the fluoride, and then you just wash it all out, right? So we say
Okay.
you can just wipe it out. Get the same bib that you used to wipe, and you can just wipe out the surfaces of the teeth, get that extra toothpaste out, and you're good. For
Okay.
adults, yeah, for
Yeah.
adults, really just a handful of water. You can
Really? I
just,
didn't know that. I thought it,
don't use the cup na you're like
as in
washing
I'm
it
like
all.
super washing it out because I read somewhere that if you put too much toothpaste, it causes the white spots. But I think it's because if you swallow it, right?
Yeah.
Or is it
And
that's
the
a myth?
white spots only occur if you swallow a lot of fluoride. So fluoride as the tooth is developing. So when the
Oh,
tooth is developing, then you're like you swallow toothpaste with fluoride, your water has fluoride, you have
yeah, yeah.
fluoride vitamins and supplements. So it accumulates. And we
Okay.
don't advocate that anymore. We really are just more in topical because fluoride really works
Yeah.
topically, meaning it just should sit on the teeth,
Oh.
goes to the saliva, and then the saliva brings it back to the teeth. So
Okay. So you
that's
don't
what
advocate the fluoridated water. Is it fluoridated? Like abroad,
fluoridated
'di ba?
water is
Yeah.
good naman,
Okay.
but the most practical
Yeah.
is still the
Topical.
toothpaste
Yeah.
with fluoride.
Okay. I have a question. What about
Yeah,
those
topical is
toothpaste
still.
with like bubblegum flavor, strawberry flavor? Are those okay?
Well, for me, the ones with flavor, they like to market it for the children, diba? It's
Yeah.
nice, it's but for me, I'm advocating, not so much of the sweet taste, and then you have cookies
Yeah.
and cream and bubblegum. And, a lot of the parents' concern is they don't like the taste of, one is
The
they'll swallow the
minty.
toothpaste. Diba? They'll
Yeah,
swallow the
one
toothpaste.
swallow.
And I go, well, if it's a little minty, they'll want to spit it. They'll be like, instead of swallowing it. So
Yeah.
I
Or they
really,
say it's maanghang. They say it's maanghang,
yeah,
spicy.
but there's variety
Or
of
maybe because it's too much. That's why it's
flavor.
maanghang.
Yeah, because you have the ones that are really marketed cooling effect,
Yeah,
diba? And then
yeah.
some is just the standard with fluoride. So we go for this just plain fluoride. No need for whitening. No need for
Yeah.
anything tartar control. No, it's just fluoride.
Sensitive gums and dami because it's
Yeah,
different kinds.
for kids. It's really for that's
Okay.
why I always tell them, you can even use adult toothpaste. You don't have to,
Oh.
if you can't find a children's toothpaste with the 1,000 parts
Yeah,
fluoride,
ppm.
then a little bit of adult toothpaste is okay. Then at least you don't have to
Okay.
buy so many things. So
Yeah.
with fluoride toothpaste, it's really amount, right? And then you just
Yeah.
wipe out the excess. So you prevent the concern about swallowing too much,
Yes.
and yet you get the benefits of the fluoride.
Oh, that's so
So,
interesting. See me, I'm even learning
mhm.
more for myself. Thank you, Dr. Georgia. So interesting. Okay, so then so it's obvious it's after meals, still after meals even for kids.
uh, well, really, it's twice a day.
Okay.
Once in the morning and
Yeah.
then once at night.
Before
And the
sleep.
night is the most important.
Yeah.
That after the nighttime brushing, there's no more eating, there's no more,
Yeah.
drinking anything that has sugar or, that type of thing. So
Yeah.
that is where we kind of have a problem when they're still feeding at night, breastfeeding or bottle feeding. So we always say, well, if you brush well, but
Yeah.
you have to be conscious about what's left in the mouth as they sleep. If
Right.
they're on formula still, when they're young without teeth, then it's fine because no teeth, no cavities, right? But when they're
Yeah.
already a year
Yeah.
and a half, and they have their front teeth, then the chances are of that milk sitting there and then being fed, you have the bacteria. If you're not brushing well, because children so
That's
young,
true.
parents have a hard time brushing. And then, your formula, which has sugars, or even your
Yeah.
cows, maybe breast milk sometimes has
Yeah.
sugar,
The sugar.
depending on what the mom eats.
Yeah.
It sits there
Right.
and then just left throughout the night. So that's where it's a little bit difficult of how to
Mm.
teach them how to control. But if we get the fluoride and the proper brushing, they're really able to clean it well, then,
Yeah.
maybe will counteract the nighttime
Yeah.
feed. But parents should really decide when they're going to stop the feeding at
Yeah.
night. Uh, you know, Once a child can hold the cup then they
Yeah.
should be drinking from the cup. It's just that our habits are pangpatulog, diba?
Yeah. Yeah. That's true.
And yeah, and
But there's also
it's
the principle of on-demand feeding kasi, 'di ba? So
yeah,
I
yes,
guess
yes,
maybe you can just wipe also before. Well, that's kind
yeah,
of an extra step. But if you really are serious about keeping your kids'
yes,
gums and teeth healthy, that's what you have to do.
yeah, and then brushing really well
Yeah.
before that,
Yeah.
or they can feed and then brush and then sleep,
Yeah.
and
Yes.
they should be able
So
to
I
sleep.
assume that it's more they're more prone if it's formula than breast.
Yes, yes,
Yeah.
yes. But sometimes, well, there's no real proven which is worse
Yeah.
than one. But you're thinking, depending on the formula, if it has high carbs, high
Yeah.
sugar, carbs, sugar content, then more sugar
Yeah.
separates or
Mm.
detrimental to the
So it's
teeth.
really sugar. Is how about
Sugar,
like carbs? Like carbs also breaks down into sugar.
yes,
So
yeah,
like the
in
biscuits and the
simple.
rice and
Mm-mm. So, well, it depends on the carbs, because you have the simple sugar. So
yeah.
really, the enemy is anything like white
Yeah.
sugar, simple
Yeah, right.
sugar. More complex is a little bit harder to
Yes.
break down to really sugar, but added sugar is really what it is. But in any form of sugar, it will contribute
Yeah.
to feeding the bacteria. So you're wanting to remove the bacteria every day, and
Yes.
that's why we brush every day, twice a day, because it
Yeah.
really will accumulate every day, right? And then your fluoride will help kind of like protect the tooth more. It
Yeah.
will make the tooth harder to dissolve, because basically your
The
what the bacteria
cavity.
produces is
Yeah.
acid, and it's slowly dissolving the
The
teeth.
enamel. Yeah.
Yeah, and that is why the cavities in children really are very rapid, because their structure is different from adult teeth. They're
Yeah.
thinner,
Yeah.
the
The baby
porous,
teeth.
yeah, are thinner. So you will have this typical what we call early childhood caries look, wherein the forefront teeth are all gone
Yes.
already.
I think I was like that when I was
Uh,
younger.
White. First, it starts chalky white near the gums, and you can really see chalky white. You know that it's being dissolved. You know it's being demineralized, and then
Oh.
from chalky white, it becomes brown, and then it just kind of like
Yeah.
the tooth is like peeling away and chipping away,
Yeah.
and it really occurs more towards the gums. So if
Mm.
parents don't lift the lip and look up there, they'll not notice until it's too late. It's like, it's all around the tooth
Yeah.
already.
And Dr. Georgia, I
Mm-hmm.
think it also is and the child also, like, it can affect their self-confidence. I mean, they can get teased in school. Do you see that happening?
Yes, yes.
Mm.
A lot of kids, because baby front teeth, the
Yeah.
new ones, permanent teeth come in at 7, 8 years old,
Yes.
right? And 7, 8 years old, that's now I think grade two,
Grade
grade
two.
three.
Yeah.
Yeah, grade two.
Yeah.
So, they are facing other people. Well, not only for aesthetics, but for discomfort,
Yeah.
pain, right? It makes them shy. It makes they have missed school days because they have a
Yeah.
toothache.
Or they don't
You
smile.
know,
No, my cousin, not my cousin, but I know someone, a kid before, won't smile for pictures.
yeah,
It's conscious,
yeah,
diba? Be conscious of your smile. So
yeah.
that's how important it is. It can affect also the mental, diba?
Yeah, yes, and quality of life,
Quality of
basically.
life. Yes.
Quality
Okay, so how do we instill in the kids the habit? Like, I remember as a kid, I loved to play, I loved outdoors, and I was just so lazy. So my older sister, had to force me, like, you have to, like, she was the one disciplining me to, what are there certain things or tricks that you suggest? Syempre,
Okay, now,
revealing your
okay. Your bad habits are coming out. Okay,
right.
remember, we want them to start early, right?
Yeah.
1 year old. A 1 year old child will really depend on the parent, the caregiver, whoever's
Yeah.
in charge of to develop the habit.
Yeah.
So the parents themselves have to instill your twice a day brushing,
Yeah.
morning and night, every day, morning and night. Can it be, oh, I forgot today, tomorrow na lang. Oh, a
Consistency is
habit
key.
has to be the same, almost the same thing every day, every day. So
Yeah.
at that time, and parents shouldn't worry that their child hates it, brushing, because at
Yeah.
a very young age, they're still oral, very oral, right? They like to stick everything in their mouth because that's how they explore. That's how they know hard, soft, diba, texture. So you're like invading their space.
Yeah.
Unfortunately, we cannot wait until they are cooperative for them to brush because it'll be all gone. It really will be all
Ooh.
gone anymore. Your baby teeth start coming in 6 months, 10 months. By the time they get to be more cooperative, right? The
Yeah.
timeline is already too late. So one is parents have to have that habit, and it shouldn't be a
Yeah.
threat, diba? It shouldn't be like, if
Yeah.
you don't brush your teeth, and even at one, it's really like, okay, we'll brush, make it fun
Make it fun.
somehow.
Yeah.
Yeah, and because I have some patients that are fine. I have some that
Yeah.
don't want, so it really depends on how the home habits are,
Yeah. Right.
right? And like we teach the parents how to brush that it's not so uncomfortable for the child. Because sometimes they just like kind of hold the chin and then they like to scrub
Yeah.
front and back and they're poking on the cheeks, they're
All
poking behind
right.
the throat, they're pushing and the child is uncomfortable. And so
Yeah.
what's the easiest thing to do is cry, right? And then they
Right.
kind of stop. So if you learn the proper or a better technique of brushing, then you're more
Yeah.
efficient and the child doesn't, complain
Yeah.
so much. So it's easier for the parents. But of course, when you're 1, 2 years old, you really have to have a little bit of holding, someone
Yes.
still, because they like to turn around, they like
Yeah.
to, sometimes they can grab something while you're brushing, they're like chewing on something
Yeah.
else. It's fine. So there's different techniques. There's songs and all
Yeah.
of that. But it has to just be a habit. It just has to happen every
Yeah. So
day.
it's really consistency, so that the
Yes.
child gets used to it, and also instill that the mindset of brushing
Yes. That
regularly.
you have to brush forever.
Yeah. That's true.
Really, every day for the rest of your life, you will have
Yeah.
to brush. So hopefully from the beginning, okay na, they're
Yeah.
happy with it.
Yeah, I remember with my boys when they were younger, I used to sing the songs with them. Like I'd put them on the sink and then brush their teeth with them. Like they'd be holding theirs, I'd be holding mine, and we'd be
Yes.
singing along. Well, for some reason they don't remember it at all. I'm the only one who remembers. I'm like, I used to sing it with you, and I sing it the song to
Like,
them. They don't remember at all. So I was like, gosh, all that work.
yeah,
But
yeah, and the things I tell parents, I'm like, you know, because one is right, we advocate when we're brushing a young child, the ones that are still in diapers, the one that still has to be,
yeah,
dressed in, in bed, then it's the
yeah,
best place to brush. You don't need the sink, you don't need the mirror, because
mm,
one, the child's 1, 2 years old, you're the one brushing and you're wiping out the extra toothpaste. So
yes,
you don't necessarily have to be in the bathroom while
yeah.
you're changing, or brush ka na, diba? And then that's it. And then let them
Part of the
start
routine.
playing.
It's part of the
Yeah,
routine of bathing and all.
when they're a little older, that they can stand and then
Yeah.
lean their head back and parents can wash. Then that's when the bathroom scene, you know,
Yes.
but when they're small,
Yeah.
anywhere really,
Yeah,
diba?
cool. So I wanted to ask for the parents of special needs kids. So I know that that's part of your specialization too. What are the specific things that they need to know? Like, of course, the concerns are different. Like, will they sit down in the chair? What kind of messages do they tell their child to prepare them to go to your clinic or to the dentist? Do they have to have special explanation? Like, what's your experience like so that
With
parents of
okay.
special needs kids could would know?
Okay, so first of all, wait, with
Yeah.
the children that are 1 year old, because
Yeah.
we want to see them at one, we're really not expecting them to sit on the chair. So we
Mm.
have this position, it's called a knee to knee position, wherein the dentist and the parent is at knee to knee, so facing each other, and then the child is, lays down on the lap, the head is on the lap of the dentist. Usually we have a board, and then the parents are holding the hands.
Okay.
So the child will squirm a little bit. I always tell parents, you'll cry, you'll squirm,
Yeah.
but it's fine. They just, don't like it.
Yeah.
And that's how our position is. When they're older, then they start to transition to sitting with the parent. They're on top of the parent, until eventually they just sit on their own in the chair. So, no 1 year old will be just sitting on their own. They need some
Yeah.
parent help there, and a
Yes.
position that we can do work. So it's a need to need position. With those with special healthcare needs, especially the ones with behavior issues,
Yes.
um, what's important is, one, when they do call for an appointment, that they say that their
Mm.
child has
Yeah.
autism,
Yeah.
or any behavior issues, so that the dentist can appropriate
Mm.
the amount of time. Like, for example, me, I have a longer appointment time for them, because it takes them a while. It's a new environment. They
Yes.
don't know what's there. So I allow them to settle down, and they're the only ones
Yeah.
there. They can explore a little bit. And I tell the parents that this time is allotted for you. So you don't need to panic and say,
Yeah.
my child's not cooperating, I'm just going to hold them down.
Yeah.
Like, because some kids can just, especially the ones that are already undergoing therapy, they're OTs, they're already doing, dressing up, brushing. It's a habit. So they're already working on that. So then, I ask them what's the sensitivities of the child. Sometimes some don't like noise, so we just use a toothbrush. They don't like, I have a TV,
Yeah.
some don't want TV, I turn it off. Some want to just sit up,
Mm. Yeah.
okay. Some want to, and then sometimes we just kind of check and see, and then it works. And then the younger ones, mom can hug and hold while we just
Yes.
check, because sometimes if the child is really, depending on the spectrum, some are really harder, more difficult,
Yeah.
but you can still kind of see. Sometimes if they want to stay out on the bench outside, that's fine. Because
Yeah.
all I want to do is to be able to
Yeah, to
see
see.
what's going on, maybe brush sometimes without toothpaste, because sometimes they don't like the taste or something, but at least we get things going. And then
Yeah.
as they age and as they do their
Yeah.
therapy and develop, then they do get more familiar with the place, and
Yeah.
they are more accepting of the procedure, because they know that it's all the same,
Yeah.
no toothache, so it's
And you can
easier.
and you can also
It's
talk to
just
them
brush.
already, right? Talk to them and
Yes,
communicate
and
with
then
them. Yeah.
they always know it's a quick procedure. It's a quick
Yeah.
procedure, so they can adjust. That's why it's really important to get them in earlier.
Yes. So
And
there, that goes
yeah,
again, earlier the better, right? For familiarity.
yeah, for behavior and of
Mm.
course prevent. Yeah,
Yeah.
but they shouldn't, because I get some parents that are so nervous. He's not gonna sit. It's like, don't worry. That's why we work around it, and don't worry. Are we As long as we can do this, then we're happy.
Yeah.
Diba? So we look like, you know, this is what we can do, then we're good. No need to panic. Then you
Yeah.
can just come back and we'll do another thing. Diba? We'll add to
Yeah.
whatever.
Oh, that's
So
really great
we
that
can go.
you work
Yeah.
with parents that way, diba? And also I think we have to remind ourselves that our kids feel our whatever energy we have, they also imbibe it. So when we're nervous, they also get nervous and stressed.
Yes. And
So
sometimes some
yeah.
parents have to be reminded that, or a lot of people have to admit, children are not
Yeah.
little adults.
Yeah.
They have to develop. They as they age, they're developing, because then you're again, it's the issue of, doesn't want to sit on the chair, but he is two, he's not gonna
Yeah.
sit, he's not that age yet, he cannot. And then, doctor, can we just do everything? You think he's not going to open, he's not going to last more than 5 minutes, because they're two, they're not going to, they want to run around already, unlike
Yeah.
adults who can open their mouth for like, hours for just
Yeah.
dental treatment. Like, they're not tiny adults, we have to adjust, we have to understand how their development is, and our treatment, or the way we treat, has to correspond with their developmental stage at this time.
Yes.
Diba? So
And I
quick
guess
visit.
that's why it's important to go to pediatric dentist, right? Like
Yes, yes,
so
actually, yes.
so there is a difference between a pedia dentist and a regular dentist because there's a
Yes,
yeah.
there is that behavior development, um, you know, aspect that the pediatric dentist will really work on the behavior of the child, and will understand what the child can or cannot do, even how to talk to the child at this
Yeah.
stage, in this age, right?
Yeah.
Compared to an adult dentist who will probably just have the child sit open, and then
Yeah.
ayaw open,
That's
diba?
right.
And
So which
they're
brings me to my
frustrated.
question, Dr. Georgia. What made you what I before we end with all your tips, which is so interesting to think that we always have you in our events. I guess maybe I should keep listening. But thank you for all your tips. And of course, it also shows your wealth of experience. But I don't think I've ever asked you what made you decide to be a pediatric dentist. You're a mom yourself, and I think that also is something that helps you in your practice since 20 years, right? How old is your eldest now?
Turning 21.
Oh, there. So yeah. So your child also grew up with your practice, no? In a way, 20
Yes,
years.
yes,
21. Wow.
yes.
Okay, so what made you choose this profession, like specifically pediatric dentistry?
Well, kids are always fun. Any child, even the well, what's good about it, if there's really a child that's so difficult, you can give him back to the parents here, and then you treat them with
That's true.
like, your parents are going to be good with you. No, I mean, uh, children are very forgiving, they're resilient, they're
Yeah.
always happy.
Yeah.
Um, they're a challenge, but the work of the pediatric dentist at least is quick. It's not an
True.
it's quick. We
Wala pang
even the
root
most
canal.
difficult
Wala pang root canal.
treatment. Well, there
Oh,
is, but
really?
it's
Mm.
yeah, we do. It's called pulp treatment, but it's unlike the adult that has to come back 10 times, right? And we see them grow. Plus,
Oh, yeah.
whatever toy that I really can't have, it's for my clinic.
Shh, okay. I know Dr.
But
charges
it's always
husbands.
but it's always a bright, fun environment. So
Yeah.
kids are always fun. So I guess that's why I chose pediatric dentistry.
Yeah.
So it's just the overall environment, and you can really see. When you have a teenager already that was with you and is like cavity free, he's so happy, even if he struggled, when they were smaller because whatever, they didn't like the taste, they didn't like the smell.
Yeah.
When they're happy and they're happy that they don't have any problems with their teeth, then
Right.
at least yeah, because
You
that's my
contributed to that.
it's their health, it's forever.
That's
So
true. And it's, I think maybe that's one myth, no, or that we can bust. Like I've read somewhere that cavities can actually, it's not only just your mouth, like it can cause like heart disease. Is it true?
yes, because especially those with congenital heart defects that are very prone to having the bacterial endocarditis. So
Yeah.
any mouth bacteria can
Mm.
actually settle. Syempre, it goes
Yeah.
down in the
It goes down.
system and
Immune system.
settle in those
Yes.
areas and cause a problem.
Yes.
So, that's why more with medical children with medical issues, we really want to get them in early. And that's why we've been like the society has been there also we're now almost 30 years or so that we really
Yeah.
are pushing for preventives
Yeah.
because it's the easiest, the most affordable, and yet the most
Yeah.
impact for your child.
Yeah.
So
So which
there.
is why I'm so happy with this episode with you. Because of course dental health is important, but then I realized that yeah, it's putting it in the minds of our moms and dads early on. Hopefully moms who are still pregnant are listening.
Yes,
Moms who,
even
yeah.
parents that are moms that are still pregnant have to take care of their
Yeah.
own oral health. So when the child comes, then they can already, it affects also how the oral health of the child. So taking
Yeah.
care of your oral health, whatever bacteria you have,
You
you
also
can
pass
at
it
least
on.
make sure you could, yeah, there's you could pass it on. And
Yeah.
another myth is like, oh, by 6 years old, all the baby teeth will be changed. But it's not true. Your permanent teeth
Yeah.
come in phases, and it comes in from usual range is from 6 years old to 12 years old.
Oh
So you have
wow.
this years of changing from baby teeth to permanent. So you have to
Yes.
take care of all those baby teeth until the
Yeah.
child is 12 years
What
old. Of
one
course,
thing I
permanent
wanted to
teeth.
ask is the how does the quality of baby teeth affect the permanent teeth?
Ah, they say that if your baby teeth have had a lot of caries, tooth decay, then
Yes.
your permanent more prone to tooth decay. That's why
Mm.
we really force when the permanent teeth come out, then again your preventives, your fluoride, and then your
Yeah.
habits have to change
Yes.
because depending on what the diet is, it's so easy to give snacks of cookies and cracker. Very
Yeah.
easy, try and limit that. So they have to eat healthy talaga. And a lot
Mm.
of times, parents again think when they think sugar, then they say, oh, doctora, they don't eat, I don't give them any candy, I don't give them chocolate. But if you ask chocolate milk, oh,
Oh,
yes,
yeah.
yogurt drink, oh, yes, and that has all
Ah,
sugar.
That's
What's your
true.
juice? It's mixed. It's sugar. So
Yeah,
it's not
right.
like candy and chocolate. It's, check out the whole,
Yeah.
whatever your child eats, right? It
Nutrition
may
is
have
also important.
sugar. Yes, very,
Oh,
very.
okay. So that's another thing to note. Okay. So thank you for sharing all this information. Hopefully, it will help our moms and dads take care of our kids better in terms of their dental health. And
Yeah.
thank you for all your work all these years. I'm sure that not only moms and dads and children, but also your fellow medical practitioners and dentists have also benefited from all your experiences. So,
Thank
parang we're so old
you.
na, no? So, I
I
wanted
know.
to ask you, so right now, how are your clinic hours? Like, are you still doing um,
I now my clinic
yeah,
hours are just 3 times a week, and then I
yeah,
space it. So I only see about 6 patients
yeah.
every clinic hour. But I still do teach. So teaching platform is in clinics for my residents and on Zoom. So yeah, so
Do you
that's
do
my schedule.
teleconsults for dental? Like, you could
Yes,
screen like that?
yes,
Yeah.
yes,
So, where
yes,
can they
yes.
reach you? So, for those parents who want to,
Um, yeah, they can. My email, the clinic email
yeah,
is toothcamp@gmail.com. And I do have a website,
yeah.
toothcamp.ph. So they can find
Okay,
all the
cool.
details there if they want to
Okay.
reach.
That's great. So thank you again, Dr. Georgia Remulla, for being here with us today and really being my favorite advocate for dental health. You're the one I call when it's about
I
teeth.
know.
So,
Thank you for always thinking of me. Ever since before it was us. So
so thank you for your time. And for all those who tuned in today, we hope that you picked up some pointers on our kids' teeth, our baby's teeth, and actually even our own dental health practices. It's something to really think about, as you know, it's not only just aesthetics, but also overall health and even mental wellness. So thank you for tuning in to You the Mom. Have a great day.